My name is Heather Taylor, and I'm a general pediatrician, and for the past 7 years I've worked with the state on newborn screening committee, but also on newborn hearing screening initiatives. The American Academy of Pediatrics has a early hearing detection intervention initiative that was the reason that Alabama has a newborn hearing screening program. As Dr. Howard showed you, hearing loss is the most common disorder diagnosed in Alabama by newborn screening, so very important thing to know about. It's a little bit different than some of the things that people have been talking about. It's not a life-threatening condition, but certainly if you're the person or the parent who has a child who has hearing loss, not being able to communicate like other people can be very devastating for you. Before we had routine newborn hearing screening, the average age that hearing loss was diagnosed was age 2. We did a terrible job at diagnosing it. Even severe hearing loss was diagnosed late. The only children that can meet their language milestones and be successful in school at an early age are the ones that are diagnosed early and that have intervention started early. That's the reason that we have newborn hearing screening. It's important as providers to be aware of newborn hearing screen results, to follow up to make sure that the hospital did the screen, that the infant passed the screen. If the infant didn't have a screen done for some reason, like the hearing equipment was broken that day or it just got missed, then you need to make sure that infant has a hearing screen done promptly. If they failed on the hearing screen, then you need to make sure that the infant has it repeated promptly. You need to be aware of the technology. There are acronyms in audiology that I didn't speak when I started working in hearing screening, OAE and AABR. There's going to be a presentation this afternoon to help you speak audiology, but the technology matters. If the infant was screened with a AABR screen in the hospital, they can't have their repeat screen done with an OAE. It may miss some of the reasons that that infant failed that initial screen. If they failed in one ear, they need to be retested in both. The incidence of bilateral hearing loss is at least 1 in 5. And they need to have that screen done just once as an outpatient. Don't keep retesting it. You're just delaying the opportunity for that infant, if they have true hearing loss, to get the intervention that they need. You're making it more likely that to have diagnostic testing that they'll have to be sedated for it instead of being able to do it while the patient is asleep. So it's really important as providers, clinics, as follow-up clinics, to make sure that we're doing what we need to do to follow up on newborn screens. And you've heard a lot from parents about, physicians being important in the role of making sure that these children get the services that they need. So it's an important step as well. If you're a follow-up clinic and you need information about where children can go for the appropriate diagnostic testing or for the appropriate outpatient referral, you can go to the Alabama Newborn Screening website to get that information. You can also get a ton of information on the American Academy of Pediatrics site. You just have to Google AAP hearing screening and it'll get you to the right page. So it's my pleasure to introduce a family that's been affected by newborn hearing screening. This is Jennifer Andress, and she has 2 sons, John and Will, who are diagnosed with hearing loss.
This has been an incredible morning listening to some of the stories, and like she said, this was not a life or death situation, but it was us, so I'm going to share that with you, and I apologize if some of it is very elementary. I know I'm not a medical professional, so I'm just going to obviously speak from the parent perspective, and I also want to point out that we chose the path of cochlear implants, so I do want to be sensitive to the fact that there are other families that don't make that choice. I'm going to speak as a cochlear implant parent, so I'm going to sort of take you through chronologically what happened. It's a little out of order. We had a son named John who was born in 2003, and it was a C-section after labor all day, and I wasn't even aware that he had had any screening at all. He passed his screening because we never heard anything about it, and life went on. He was great. He was in daycare as I worked, and nobody had a clue anything was going on with him. At 11 months, we had had a series of tubes, ear infections and tubes, and we were told that at the first set of tubes that our son had hearing loss. You know, they put you in the booth, and they went through the testing and told us that our son had hearing loss. And we didn't have any hearing loss in our family, which the majority of children diagnosed with hearing loss come from families with no history of hearing loss. So we had no experience whatsoever, and we thought they were talking to the wrong family. Clearly, they misunderstood. We were just here to get tubes. Thank you. I know it's a 10-minute procedure, and then we'll be out of here. So, no, in fact, they did detect some hearing loss on his screen, and when he had his tube surgically implanted, they took some blood and did a blood test. And the blood test came back positive for connexin 26. I was 18 weeks pregnant at the time with Will. And so connexin 26 is a genetic disorder which causes the hair cells in the cochlea to be damaged. So the hair cells that pick up the sound waves and move it back to the auditory nerve are damaged and don't work, don't bring the sound back to the auditory nerve. So we knew that we had a chance with Will. The chance of connexin 26 is the same as cystic fibrosis, so it's 1 in 33 that you would be a carrier. So we knew that we had a chance, obviously, with Will, that he would also be born with hearing loss. Parenthetically, a month later, I was diagnosed with breast cancer. I'm fine, everybody, we're all good, but it was just a rough 2004, so let me just tell you that's going on the side. So Will was born, so we were offered, the geneticist at UAB offered us a test for Will to see if he was, in the womb, if he was going to have connexin 26, which we declined because there was, it wouldn't change anything. And so Will was born because of my diagnosis. We took Will 2 weeks early in a C-section, and this is where, I start to get a little emotional. They took him back for his hearing screen. And at this point, we know this is going on. And the sweet nurse, and she didn't know. She didn't know we had another son that was hearing impaired. John, by the way, had been fit for hearing aids at this point and had started speech therapy. At 11 months, fit for hearing aids at 12 months, started speech therapy at 12 months. So she took Will back, and they were gone for a really long time. And so we knew, we knew they were gone so long, and she came back and she said, oh, it was just, the doctors were in and out of the room, and it was just so loud in there, and I just said, we're going to try again, and we're like, don't worry, we know what we got to do. We've got our people at Children's, we're ready to go. So we left the hospital, a week later, I went to have my stitches out or my staples out for my C-section, literally picking him up in his little carrier, whisking him over to Children's the minute I left there to go get him with his first ABR. So Will was born profoundly deaf. So the difference between the two children is that John was not diagnosed at birth with his pre-screen because he had enough natural hearing that it wasn't caught. And that's why for 11 months we had no idea that anything was going on. Will, however, was profoundly deaf. So we have an ABR1. I think we had a second ABR. Meanwhile, I'm going through radiation every day. And we get in the queue for our cochlear implants. And Audie Woolley is our physician up in Birmingham. And, you have to go through he has to wear hearing aids for a certain amount of time to make sure that he is not receiving any benefit from the hearing aids. We have the CT scan to make sure the anatomy is normal, which with the connexin 26 baby, they're non-syndromic. There's nothing else wrong. It is just this hair cells that are damaged. So we were going through the queue, and this was in 2005, and 2004, and going into 2005. And so these things they're doing it at a quicker rate now. But Will received his first cochlear implant at 10 months. So you can see the importance of a newborn screen and catching hearing loss. And like she said when she was introducing me, the quicker that you catch these babies and you get sound to that auditory nerve, the better your outcome is going to be. So I have two children that I can talk to about the differences. John, who was a firstborn and who had natural hearing, and we had no idea anything was off course, never missed a beat. He got hearing aids at 11 months. We were right into speech therapy. We worked with that natural hearing as long as we could until that finally declined, and at age 6 he received his bilateral cochlear implants in the same surgery. Will, on the other hand, was completely deaf until 10 months old. No sound, even with these gigantic hearing aids that squealed. And the thing about the hearing aids, just aside, is when they're babies and you have those molds made and then they grow 2 seconds later, and then the squealing because it doesn't fit in the ear anymore. So we had several years of that going on. But Anyway, so Will received his first cochlear implants at the time in 2005. They were still doing 2 separate surgeries. Insurance, in fact, was not covering a second surgery. They were not paying for a second implant. And my husband, who's an attorney, and other families in Alabama worked very hard to have that overturned. And so now insurance is, will pay for a bilateral because obviously, I mean, the benefit that a child receives with two cochlear implants versus one, the localization of sound is the most important benefit that they receive. So if a child is walking, and something's coming up behind them like a car, I mean, to be able to localize that sound, you need both ears, and, it shortens the amount of time it takes them to realize what's going on. So Will then, and he had started speech therapy immediately, of course, after he received his hearing aids, but really receiving no benefit because he was getting absolutely no sound whatsoever. So at 10 months, we start working extra hard, and he was implanted with his second cochlear implant at 22 months. So again, John, my 12-year-old, never misses a beat. He's going on, and we're doing weekly therapy, but he's, just cruising along. Will, it was just a constant struggle. Now, I don't know if any of that is personality, and I don't know if any of that is that he was the second born, but, just the speech developing a little later. But I'm telling you, it was solid work for 5 solid years. Couple of weeks of speech therapy, constant work on my part. I quit my job at this point, was a full-time stay-at-home mom. I can tell you that the spring before he went into kindergarten, I'll never forget sitting in the office at the school having an IEP, getting ready to go into, starting his kindergarten in a few months. And for the very first time, he tested at the same level verbally that his peers do. And it was just like, okay, we've made it. Because that was the concern, was he going to be at the same level as his peers? And that's all we asked for. That's all we wanted. John, so it typically happens, Dr. Willie explained to me, that children who have connexin 26, who were like John, that were born with enough natural hearing that we didn't catch it, right? They tend to progress over time. And the big progressions happen when something happens in the body, like between the ages of 2 and 3, between the ages of 5 and 6, puberty. So sure enough, John had turned 6 in May of 2009, and we started getting a lot of, what mom? What mom? And really noticeably, the TV would be on so loud, or he would be in the back seat of the van, and for the first time wouldn't be able to hear me. We'd never really noticed any of that before. Even with the hearing aids, he had been receiving benefit, even though we had steadily been increasing the level of hearing aids he was receiving. So the summer of 2009, we knew that he was going to end up having cochlear implants, and we knew he was going to be fine, but it still is very traumatic to send your healthy 6-year-old back and just going down that road again. But we knew he was going to be healthy, and he was, and he had the surgery, and he was actually the first child to receive the Nucleus 5 from Cochlear at the time. It had just been FDA approved, and he's wonderful, and they're wonderful. They're great. They're wonderful, wonderful. Straight A's, athletic, happy boys. So that's our experience. I will never forget that nurse. I don't know who she is. I don't know what her name is, but I will never forget ever that nurse taking him back and coming back to us and saying, "Oh, this guy was just so loud in there," and the doctors kept coming in and out of the room. I'll never forget it. So thank you for all you do. I'm happy to answer any questions, and thank you all for having me.